Hey everyone, it's Dr. Rick, and I want to show you how I would like you to take your blood pressure. So this is an average blood pressure cuff I bought at the pharmacy, and it should be wrapped around your arms so it's snug. And then this listening part with the pipe or the tube should be around the front of the arm crease. You want this snug, but not constricting, and that, these are always constricting. So I usually say if you can fit a finger up about here, that's decent enough. And the way you have to do this is you have to have both feet on the ground, you have to have your back against the chair back, and you have to have the cuff at heart level. This is my heart level, it's a little bit above the nipple, and I usually say just put your arm on a table. And believe it or not, you have to rest for 5 minutes in this position. And that's boring. And this is the reason why, because I never did this before. You always just walk into the room and take a patient's pressure. Now the medical assistant or the nurse is supposed to do that, but when you go to an urgent care center, you'll be walking in from the waiting room and they'll sit you down and they'll immediately take your blood pressure and pulse and temperature. Now, that's because in an urgent care center, we gotta get people in and out. And if we have 10 minutes to 15 minutes max, hopefully your medical problem will fit into that little window. Who's got time to wait for a 5-minute blood pressure cuff? I mean, the assistants will go in, take the pressure and leave, and then they'll input the data, which takes another 3 minutes to 5 minutes. And then I'll read it and I'll walk in and get my history and whatever. That's why things are so fast well, I don't know why things are so fast, but that's the way medicine is with insurance-based stuff. But that's what we have to deal with, and I think we can make it work. But when you've been told at the office, whether it's a immediate care center, emergency room, or your doctor's office, that you have high blood pressure, no one should be treating you right then and there unless if it's hypertensive crisis, that's a problem. If it's hypertensive urgency, that's a problem too. Crisis is when you have end organ damage, a heart problem, an eye problem, the kidneys are spilling over protein. That means the blood pressure is doing something, or blurred vision. But if it's not, and you just have hypertensive urgency, meaning you're 200 over 100 and you're not feeling it, well, that's not good. Those organs I just mentioned, the heart, the kidneys, the brain, and the eyes, they can't take that kind of pressure front for too long. So the idea would be that if you can check your blood pressure at home, it's called ambulatory blood pressure reading. That would be great. You want it in the morning and at night. But when you do it, make sure you follow the rules. And the rules are both feet on the ground, back against the chair back, arm, the blood pressure cuff arm at the same level as the heart. I can lower this one over here, but I just chose to go like this. I pretend I'm praying or asking God, please give me a low blood pressure. So you have to stay like this for more or less 5 minutes. And yes, you have to count it down. I think it'd probably be okay to watch TV. I wouldn't watch wrestling or a basketball game or a fight like John Wick. But I would probably, you know what, just leave it off. Look out at the sunset or look out towards the sunrise. Or just sit there. You're not even supposed to have a conversation with somebody. And you're not supposed to be doing this with your phone. So the idea is you just sit here for 5 minutes. I'll explain why. If you're bored, suck it. So if you just sit like this, and then after the 5-minute mark, take the other hand, press the start button, and you return. Deep breaths in and out. And you're supposed to relax while this thing chokes your arm off. And is this fake blood pressure relaxation? Yeah. You breathe in and you exhale slower than you inhaled. And, uh-oh, that's high. But I was talking, I don't know if I rested 5 minutes. So, 129 over 86. So that should really be 120 over 70 or lower. but it has to be done properly. And this is the reason why you have to wait 5 minutes. There are certain numbers. If you go above a certain number, like 130/80, if you're following the ACC AHA guidelines, or 140/90 if you're following the JNC8 guidelines, you don't have to worry about that, but they're just two guidelines. One is the American College of Family Practice that they follow, JNC8. The other is the cardiology guys. But both of them are looking towards saving your life and decreasing the chances of stroke and heart attack. The reason you have to sit for 5 minutes is because they determined through the SPRINT trial and the ACCORD trial, 2 trials before, that people that had a certain blood pressure that was high, and what I just mentioned, went on, if it was continued to be high, with heart attack. People with lower than those numbers that I just mentioned did not have a heart attack. And they had those people wait in this position for 5 minutes before checking your blood pressure. They had to neutralize all variables to make the study reproducible. So that's why you have to sit for 5 minutes, both feet on the ground, back against the back of the chair, an arm at heart level, and no talking and no texting. No texting, no drinking, no driving. So the reason I tell you to do breath work is just to keep yourself busy. And I think when you increase your inhale and you slowly exhale twice as long as you inhaled, that produces a parasympathetic response. And here's the freebie for today. We are too driven in sympathetic response. And the autonomic system is sympathetic and parasympathetic. Sympathetic meaning fight or flight, run away, fight an infection. Parasympathetic like love, family unity, laugh, make love, reproduce. So there's supposed to be a balance of both. And unfortunately, I think everybody's in here. So that's why I teach mindful practice. I teach nature therapy, going out. I think nature and exercise is a way to distract the brain from anxiousness and anxious thoughts and the politics of today. But it's not enough. You have to turn off your brain, and that's usually mindfulness. Prayer is one way, recitation, where you're just saying prayer over and over again. That kind of gets you into a little trance. I do this thing called a rosary in Catholicism, and I do this rosary in the morning and at night, and it takes me about 15 minutes, or I can do it really fast for 5 minutes and just make it monotonous. But this is how I grew up, and it makes me feel good, and it does release endorphin, I'm sorry, not endorphin, enkephalin. Endorphin and enkephalin is for exercise. That's release the hormone. But during calm and meditation, you have serotonin and oxytocin. And if you remember those hormones, those are the same hormones that release when you have an orgasm, or when you watch somebody get a hug. Like a military guy comes back from Afghanistan or the Middle East, and the little kids in kindergarten, and they see their parent for the first time in like a year, and it's so touching. A lump gets in your throat because you're watching that. Well, imagine what they feel. And so there's parasympathetic response that we get sometimes, and there's a sympathetic response that we always get nowadays, because violence is easy to watch on YouTube. So we have to balance it out. If you're more sympathetic, you're going to have high blood pressure, you're going to have inflammation, you're going to have sleepless nights, you're going to have impotence and dry vaginas. Nobody wants that. If you're parasympathetic, you'll have decreased inflammation, you'll live till 100, you'll have no cravings, and you'll be friendly. So I think it should be balanced. Certainly can't just be a monk in today's society, and you can't be a SEAL, Navy SEAL in today's society alone. It has to be balanced. But if you don't know what to do or how to balance it, then you come see me. I'll put the link to my practice in Illinois down below, but I also see people from outside the state of Illinois virtually and outside the US virtually. I'm here to help. This is just something I share with my patients to get the best techniques for measuring blood pressure, and then moving forward to design exercise, mindful practice, nutrition practice, fasting, sleep optimization, and live till 100. I just came back from Rome, and I tell you, that is the life. I ate so many carbs over there, but I didn't gain weight. And I didn't even run. I didn't exercise. There's no place. Well, I had 2 places I exercised like in 10 days. But there's hardly any places to exercise because everybody's walking everywhere. When I came back, I felt bad because I thought I won't be able to do my 5K. It was the 8K, the Shamrock Shuffle. But I came back and immediately into the Shamrock Shuffle. I did it without even blinking, all because of all the walking I was doing in Greece and Rome. Anyway, so try to do your best to be helpful and healthy. Try to do your best with your doctor's advice. If you can't get it, then you come and see me. Thanks for watching. Pass this along to other people. Give me a thumbs up if this helped, and I'll see you in the next video.